That is a very good question. And actually, we have had vaccines for a very long time since, Edward Jenner discovered the vaccine for smallpox. And vaccines have enabled us to overcome a lot of diseases over time. So when it comes to COVID-19, it did make sense that the first thing that the medical people would look for was whether there was a vaccine for COVID-19 or not. And we have been quite fortunate in many ways that we did manage to get vaccines. And we have a range of vaccines, many types, and all of them have been found to be effective and particularly effective against, severe illness and also hospitalization and death. So even when they say maybe the vaccine is about 67% effective or it's 90% effective, we have found that all of the vaccines do reduce severe disease, hospitalization and death. And that is the aim really in this epidemic, to make sure that we do not have people, overwhelming the health system because they are very sick, or we don't have people losing their lives. So everyone is truly encouraged to utilize the vaccines because they are quite effective. Regarding safety, all medicines and all vaccines which are used in allopathic medicine, and by that I mean Western medicine, because there are various branches and types of medicine, like homeopathic medicine, traditional medicine. And so when I say Western medicine, it's allopathic medicine. Those medicines we thrive and value that they have gone through rigorous testing. And so when a drug or a vaccine is being developed, it goes through various stages: phase 1 trials, phase 2, which are mostly about safety, and then phase 3 trials. And the phase 3 trials are when you are looking at the population to see if the vaccine is working. So before you do that, you actually have gone through the safety checks, and any a vaccine that is now being rolled out as a fully licensed vaccine or is in phase 3 trials has actually been stamped as safe for use in humans. And what I want to point out, however, is that the safety does not mean there are no side effects. Most, even drugs, have side effects. If you take any packet of tablets, even Disprin or Panado, you will find a long list of the possible side effects from that Disprin or Panado, starting with the most serious to the least serious and uncommon. And therefore, even for the vaccines, we do have side effects, but most of the side effects, really, it has been found that it's in very few people. There are very few people who have serious side effects. And even for those who have those serious side effects, the number that get the side effects is very small, to the extent that when you look at the benefits of the vaccination, those benefits far outweigh the few people who might develop a serious side effect. Some of the numbers are maybe you have one person having a serious side effect out of 1 million people that have been vaccinated. And so all in all, really, the vaccines are very safe. We have picked up from, social media, people saying that vaccines affect your, the reproductive system. There have been no recorded impacts of the vaccine. The only one coming close to the reproductive system is where some people, when they have their initial dose, if it is women who are in the reproductive phase, they maybe have a heavier period than they would have, and it does not usually last beyond that one period. But when it comes to citing things like it will cause a change in your reproductive organs, or it will make you sterile. There is absolutely no evidence to that effect. The manner in which the vaccines work has got very little to do. It has nothing to do with the reproductive organs. So there should be no fear that, you know, the vaccine will cause any infertility or it will make your organs shrink. There is no evidence of that.